today is just thinking about disagreement over the type and intensity of services in school practice. And the reason this is our ethics topic for this year is that I frequently get the email or the call from an OT practitioner in the field calling or emailing in frustration or even distress after they've come out of an IEP meeting and the IEP team has made a decision about services, which is really different from what the OT practitioner thought should happen, right? And so they're feeling in an ethical bind, tension, dilemma even, because a decision about services, which they are going to be expected to implement, was made that they don't necessarily agree with, and it could be for any number of reasons. But I just got a little bit tired of having terrible answers for those people reaching out for help. So investigated a little bit, like what do we know from other healthcare professions and inside the dispute resolution literature that kind of walks us through what do you do when a team disagrees about what should happen with a client or a student. And we're going to see here in a minute, this is not a conundrum that is specific just to occupational therapy practitioners. It's across healthcare professions that this comes up. So we will move on, Amy, to the objectives. And so here's what we're going to unpack, and I will say we will not be going the full hour and a half. Our experience in the previous webinars that we've done for this content, it's taken us about an hour and 15 minutes, wouldn't you say, Amy? And we'll certainly want to leave some time for questions and discussion at the end. But in a little more than an hour from now, the ground that we would like to cover with you is to give you a better understanding of some of the ethical and relational and emotional dimensions that surround disagreement over the need for or the type or the intensity of occupational therapy services, right? And we're talking specifically about school-based practice. We're going to talk about what are some of the potential outcomes of that disagreement, and then what do we know about some features of successful resolution of disagreement over services? What tools do we have? What kind of thinking processes are available? What do the experts in dispute resolution say when there's disagreement over a healthcare service? Okay, so we can press on to our first little consideration here. So on your agenda, there should be this table that you see on your screen. And so what we want to do, especially if you're listening or participating in the webinar with a friend, is Amy, we can see your screen. So if we could bring back up the PowerPoint. There we go.
Sorry about that.
Because of, it's okay. I'll just alert folks that are on the call or having difficulty getting on the call. Amy is not going to be able to provide tech support in the same way as we have in the past because she's running the PowerPoint. So if you have a friend who's having difficulty getting on, let them know that. So we want you to take just a few minutes. In fact, let's take about 5 minutes to do this little activity here, and maybe Amy can troubleshoot some people who are trying to get on the call. So what you're going to do is, by yourself or with your small group, just reflect on, are there times in your practice, this school year even, where you have been involved in disagreement about the need for service? That's the first column there on the left. Or a disagreement about the intensity of service, and by that we mean is the IEP team, our members in different places about how much, not everybody agrees, yes, the student needs OT, but how much. So that would be a disagreement over intensity. And then list if you've had any conversations or discussions or disagreement in that far right column where the team ended up in disagreement over the type of service. Right, and so there we're thinking about potentially a parent asking for a particular type of intervention, or for the one of the team members thinks that the student needs to be served using a particular theoretical framework. Say sensory integration is a pretty common one that people have ideas about the need for, and maybe the occupational therapy practitioner sees it differently. So just take a minute and brainstorm conflicts, the different types of conflicts you have heard of or experienced in any one of those three areas. So I have 3:13 now on my computer clock, and we will I'll check back in with you about 3:18.
I just wanted to let everybody know, if you can see the handout section, if you don't have the agenda, this is actually, I set it up in the handouts section of the webinar. You should be able to download it there as well.
Yeah, and we will be asking for people to share their reflections on each of these different categories of conflict here in a couple minutes. One more minute to wrap up your conversation or your thinking. Okay, Amy, do we want to open it up to let people share the experiences they've had?
Yes, and what we are going to do is I'm going to just unmute everyone, or do you want me to just have them raise their hands?
Yeah, if you could just raise your hand on the screen if you've got something to share in one of these three categories of conflict.
Yeah, just raise your hand and I'll unmute you and you can speak. Those that are on listen only, it looks like I can see your questions. So if you would like to type it in, just let me know. And I have no one raising their hand. If you would like to start a discussion, please raise your hand.
Or just add a comment. Anybody out there, have you had any disagreement over the need for OT at school? Or how much OT a particular student needs?
Okay.
Wanted to get a sense of the flavor of that conflict.
All right, Tammy, I have you. Tammy?
Yes, I'm here. Yes, we've had all three situations: disagreements with need for service, intensity, and type of service. Type of service is typically more related to whether they require AT intervention, as well as sensory integration seems to be another area where we get that issue a lot.
Yeah, did you say the first one was assistive technology?
Yes.
Yeah, okay, yeah, that's a yeah, so even that's a good point. It makes me think not even intervention itself, but even like the type of evaluation that might need to be done. There could be conflict over that. Yeah, good. Oh, so how did the intensity conflict or disagreement manifest?
Typically, those that want students to have services greater than once a week, or want students to have a higher intensity of service when their goals tend to be goals that are integrated and may not require that level of intensity.
Okay. Good. Are there others who have thoughts about one of these categories? Maybe one or two more folks to share, and then we'll move on.
Yeah. Yes, we have quite a few. So I'm gonna.
Awesome.
Laura Wills.
Okay. Yeah. Hi. Well, I'll start by saying that I'm actually in Texas. One of my coworkers told me about this webinar, and I wanted to participate.
All the way from the Lone Star State.
All the way from the Lone Star State. So,
welcome.
Yeah, I've also experienced disagreements about all three. I think most recently I've experienced disagreements about need for service with some students who had been receiving OT services, but I felt that they were at a point where they could be dismissed from OT services because it wasn't educationally necessary. In our department, we actually use a document from the North Carolina Department of Education defining what is educationally necessary in terms of occupational therapy. And in at least one case, I just finished the pretest, and I saw the term bullied acquiescence, and immediately I was like, yep, that's what happened. Because I'm trying to stick to my ethics and my license as an OT practitioner and not do what I don't feel is educationally necessary for a given student. But when the ARD committee disagrees, it's sometimes not exactly a consensus decision to keep a student on services. It sometimes does feel more like bullying.
Okay, so let's hold on to that. Yeah, and we are definitely going to return to that notion and the sort of the problems with that approach to resolution, right? So thank you, and fun to hear that we've got all people outside of North Carolina participating today. And actually, it makes the conversation richer to hear how other states practitioners in other states, school-based practice settings are or are not wrestling with some of the same issues. So cool. Maybe one more person, Amy?
Well, I just wanted to tell you about 2 of the write-in comments that I have.
Yeah.
I'll
Perfect.
just
And then we'll move on.
Yeah. That way also everybody knows that I'm actually seeing them. Monica Monica Parson says that a parent did not want OT at school due to the service time that was offered during the meeting. Also, Sue Poor is saying that they've had issues with the need for OT to teach keyboarding services in middle school.
Right. So that would be both need for and type of service conflict. Right.
Yes.
Yeah. And I think that's a good point, that particularly under that category of type of service, we often see conflict where OT is being asked to duplicate the work of another discipline or something that should be or is offered through the curriculum. So let us move on. Thank you all for contributing. It's exciting to hear that people are using both the write-in and the raising hand. Keep it up, folks. So we're ready for the next slide.
All right.
So I don't have it doesn't look like on my screen that the slide has changed.
Is everybody else seeing the next slide? Raise your hand if you can see the next slide, if you're still. Okay, so Lauren, can you try to refresh? Everybody else is seeing the next slide.
Oh, well, here we go. Just coming up now. As our late start indicated, there is something clunky about my internet connection here at the State Department of Public Instruction in Raleigh. Anyways, all right, so why this topic? I did mention that why are we talking about this as an ethics conversation? And one is, I mentioned earlier, it's a question and or like opportunity for me to process with practitioners often, and I haven't had very satisfactory support to provide people who are in this situation. But if you'll click again, Amy, we'll see that disagreement between patients, families, and healthcare professionals about treatment decisions is the #1 reported ethical issue across healthcare providers. All right, this is, like I said, not just OTs. That this is, when polled, this is the #1 issue. And often we see, like in the hospital setting, and with physicians and other medical professionals, that this is often related to end-of-life decisions, but that's not all of the sort of the landscape of this disagreement over interventions or treatments that the client is going to receive, right? So let us move on. I just want to just offer that as the literature is telling us across healthcare professions, disagreement over the need for service or the type or the intensity is the thing where healthcare practitioners get into the most sort of ethical confusion. All right, so when we're thinking about disagreement, really 2 categories of disagreement over the need or type or intensity of service. The origins or the root cause of those disagreements tend to have kind of 2 main origins. The first and most common is the communication-based disagreement. And that's really where the situation is riddled with poor communication skills and or efforts on one or both sides of the disagreement, right? People just aren't using their best communication skills. And with that, the kind of the results of that is that there's often on one or both sides of the disagreement missing or misunderstood information. So somebody's not working with the full data set, or they've misunderstood the information that's been provided, right? So the disagreement arises because of communication errors. The other, and less common, but I think we'll talk about it here later, in school-based practice, is where there are system barriers, whether it's policy or procedure or availability of personnel, right? That people are communicating well, but it's the system that's prohibiting one of the sides from getting the outcome that they want, right? So it's an organization or process-based disagreement, right? That's limiting, and this is seen more, say, in healthcare settings where there are limits to the amount of service that a third-party insurance payer will reimburse. And I think we are seeing one of these, that organization or process-based disagreement with some of the visit limits we have with our state Medicaid agency right now, that are in fact affecting school practice. So that would be an example of a process-based disagreement. Where, and in this case, it's where the school has said that the student requires occupational therapy in order to be appropriately educated. They've offered that as a part of the package of FAPE, and yet the parent is turning it down or says, no, I don't want it, so that I can keep my services in the community. Because they're feeling like if they take the school service, then it'll affect their benefits or access in the community. So that would be an example of an organization or process-based disagreement. Okay, but by and large, the biggest source of disagreement we have in school practice is these communication-based disagreements. So let's move on and explore some of those a little bit deeper. So I'm assuming I'm still lagging, and I'm going to go on and begin talking about, yeah, here we go, the ethical dimensions of team disagreement about services. So we're going to, like we mentioned earlier, to explore some of the ethical, relational, and emotional dimensions of what happens among team members when we're disagreeing about anything, but particularly about the need for service. So it feels pretty immediately like an ethical obligation for the occupational therapy practitioner, and already it was mentioned by one of the people who offered a comment, that we have an ethical obligation to provide services that are according to the standards of practice for our profession, that in our particular practice setting are educationally relevant, right? We have to ensure that students are making adequate progress, and for us, that means toward age and grade level standards. We have an ethical obligation to make sure all team members are involved in decision making, and the best way we know how to do that is to ensure that everybody has the same information about student progress, about their performance and their progress. So that requires that everybody has access to the same data about student performance, right? And we have an ethical obligation to ensure that all of the laws and policies and ethical code of ethics are upheld. We also in occupational therapy as a profession have said that we are a client-centered service. And I want to just think a little more deeply about client-centered practice here in the next slide, and how there may, particularly in school-based practice, we run into some some difficulty with client-centered practice. So let's go ahead and look at the next slide.
I'm on the tenets of client-centered practice slide. Are you?
Yep.
Yeah.
Yeah, I don't see it, so I'm just going to move on. And so maybe, given the lag, Amy, if you could say the slide has been advanced. I'm sorry that's so goofy, but just so I'll know where most people are seeing what's on your screen. So the tenets of client-centered practice, just to review briefly, we all learned this in grad school at some point. But just as a reminder, and also then to problematize a little bit what happens in school-based practice. So for the client, they're in the framework of client-centered practice, the client is responsible for being the expert in their own life, in their hopes and their values, in what they want as a result of participating in occupational therapy, and they have to teach these to the occupational therapist. The client is the one that gets to assign meaning, that gets to say and choose what matters and what doesn't. They're the ones that get to choose their goals, set them and choose them, and prioritize which ones they want to work on when. And in most practice settings, except for schools, they get to select the professional with whom they're going to work. Now, well, I'll say we'll talk about the OT responsibilities and then kind of scratch our heads a minute about what this means in terms of school-based practice. But for the OT in general, responsibilities in client-centered practice include being aware of the OT being aware of their own sort of value system, biases, preferences, and sort of checking those and deferring to the client, right? Creating an environment where the client can lead, be the leader and the teacher, and that the therapist assumes a posture of learning as the one who's being taught. And also more of a facilitated than directive role, right? So the difficulty then that we run into is in school-based practice, and we've talked a lot here in North Carolina, the client is not just the student. The client, in fact, is the entire IEP team. And when we have multiple people, a client group that we're sort of trying to engage in client-centered practice, things get very complicated very quickly. And I think that's why we feel so often in sort of in so many different directions we experience or encounter disagreement over services, and why we feel so sort of torn up about it, because we are a profession that has committed itself to client-centered practice, and yet we have this sort of diverse client group that we're trying to meet its needs as well as kind of maintain our own sense of what is the good and right and evidence-based thing to do in this particular case. So we'll move to the next slide, which is talking about, we've touched on some of the ethical dimensions of disagreement, and now we're going to explore some of the relational dimensions. So, and I started that a little bit with school-based practice. We have multiple stakeholders, and this makes it difficult to figure out which of those stakeholders do I choose for my client-centered practice. Whose autonomy is at stake? Right? Is it the student? And very often they are a minor in care of a parent, and so then decision-making really is transferred to the parent. We have this whole IEP team that's a self-determining body, but it's not actually the direct recipient of the OT service. The IDEA says this team is the decision-making body and has a right to accept or refuse the offered interventions. Not necessarily to name or select the interventions that are offered. We do that after the IEP is developed in our intervention plan. But at the point of intensity and whether or not OT is going to be part of that student's IEP or not, that decision really belongs to the IEP team. Do need to acknowledge, listen to carefully what the parent is wanting to happen, but they don't have more influence than other IEP team members. And then, of course, the OT's autonomy over their own practice, the resources they have available to implement the considered interventions, and also the considerations over any supervised personnel that would be providing the interventions, right? So very complicated relational dimensions when disagreement over service is what the team is facing. So then that would take us just a couple more thoughts about, on the next slide, the relational dimensions of disagreement.
I have advanced.
Yeah, great, thank you. And it looks like I'm got a little bit better connection, so I'm operating in a little more real time. We also need to be aware of, in this relational consideration of disagreement, that there may be bias on either side or from any of the parties that may be affecting sort of the perspective that's taken. This often happens without conscious awareness. In school-based practice, we often have this like picture of or perspective that this is a difficult parent or a difficult family. And curiously, in some of my research around this issue, when there's disagreement between families and healthcare practitioners, it is really common for the healthcare practitioner side of the disagreement to attribute psychological issues to family members or to the family as a whole to try to make sense of the disagreement, which reminded me of, unfortunately, how we often refer to families having their own special ed needs. The other thing that really complicates the relational dimensions are that the parent may have a history of difficult interactions with the school district or a particular school and are coming into this new agreement over services from a place of distrust, and or the school system has had difficult relationships with this family in the past and is again coming into it with sort of bracing for yet another disagreement. So that is all to admire the problem, right? We will get to thinking about doing something about the disagreement, but it's worth sort of highlighting why the relational dimensions in school-based practice over the disagreement about services is so complex. So I think we're going to move on to the emotional dimensions of disagreement next. And again, this is largely informed by the dispute resolution literature that I looked at around disagreement and reaching consensus resolution. So some things to be aware of, and some of this is really common sense, but it's a good reminder that strong emotions in the context of disagreement, if strong emotions are surfacing in the course of an IEP meeting as the team's trying to negotiate how much OT or if OT at all, those strong emotions can have the appearance of carrying greater moral weight. Like, the madder I am about this, the wronger you are. Right? That's terrible grammar, forgive me, but you get the idea. So There's also, for us in school-based practice, often sort of this undercurrent emotional landscape of working with chronic, slow to improve conditions, and that needs to be named and acknowledged. And this is the case for families as well. So whether it's about the need for services or who's going to take out the trash, disagreement often breeds anxiety, anger, frustration, impatience. And when those emotions are present, what we do know is, one, those can make fruitful conversation difficult. It kind of clogs up dialogue. Those feelings also anger, anxiety, frustration, tend to feel very justified. The person who's feeling them feels very justified in having them, and they're often a signal that this person who's feeling angry or frustrated or impatient is experiencing insensitivity by the rest of the group and or the person or the entity that they're arguing with, right? They feel like there's a lack of empathy or effort to understand what it's like for them. So when you're experiencing anxiety or frustration or anger from the person you're in disagreement with, this is just a signal that they may be experiencing you as not necessarily caring, right? So then there are these other more moral emotions like grievance, indignation, resentment, injury, right? These are signals of offenses that have not been articulated. Like people are holding on to stuff, right? And those are often driven by an experience of invisibility or where there are profound power imbalances. So those resentments, grievance, right? Got an axe to grind kind of feelings. It's just helpful to consider that this person is not feeling heard. Okay, so what do we do with all that emotion, right? And moving on to the next slide, how do we handle that? So emotional engagement, what we are the emerging perspective in the dispute resolution literature is that emotional engagement is almost always required to reach resolution, right? Which means we have to recognize these strong feelings that people are having as they are, naming them without trying to adjust them or temper them or like shut them down. We need to sort of name, ennoble, allow people to have them, own them, situate them within the conflict, right? Because what we want to do is try to welcome them, these strong emotions, as clues for sort of the heart of the matter, right? They're going to help us get to the root cause of what's going on. We want to try to view them as a symptom with a reasonable source. Like, not very many people really enjoy feeling anxious or resentful or angry or frustrated, right? Those are not feelings that people necessarily want to feel. They're not making them up. So if we trace them to their source, we're going to be helped. So the idea here is, like, don't necessarily run from or try to shut down these strong emotions when there's a disagreement over the need for service or the type of service, but let's use those emotions as a sort of a roadmap for, okay, how do we get to resolution? And I've loved this notion of avoiding the bias of decorum. Certainly we don't want to let people just rant and act inappropriately in the course of an IEP meeting, but sort of American culture really has this bias of decorum where we don't show emotions at all, right? You just do the rational kind of stony, cold, chill, bury it till we get through this thing. And like I said, from the emerging literature around dispute resolution, that's not necessarily a productive approach. So how do we sort of stand up tall in, moving on to the next slide, and engage disagreement in order to move the team forward? All right, so the goal is to reach consensus resolution and avoid this notion of bullied acquiescence, which our friend from Texas mentioned, right? So bullied acquiescence is often a function of this bias of decorum, where people, nod, yep, they just kind of shut down and bury it, and they agree to something externally that they in no way internally really agree with. They kind of do this settling thing. And what we know about bullied acquiescence is that it lasts often until the person gets out to the parking lot right after the meeting and then starts the parking lot rant. Decisions made where bullied acquiescence has occurred, those decisions tend not to be implemented well and are often and pretty soon after the decision made, somebody is sabotaging that situation. So it's just not worth it. Those decisions don't last. They don't have any traction. Implementation tends to go poorly when bullied acquiescence is part of how the consensus was achieved. So if we're going to avoid that, all team members really are going to have to envision a positive outcome. They can't just say, oh, here comes another 4-hour meeting that means I'm going to be home late, right? We've got to envision something different than torture. So we also need to enter that space, that meeting that we know is going to involve disagreement. We've got to enter that space with a mindset that we're going to be educated, that we're going to learn something from the person or the group who's disagreeing with whom we disagree. Be willing to offer what we know and then also be educated. So everybody's trying to learn the other person's perspective. Staying student-centered is really important. We want to ensure the IEP team have an accurate understanding. Again, this is why data is so important when there's disagreement, that everybody's working from the same data set and has a really clear understanding of the student's status, right? And then we want to think about ways to optimize possibilities for problem solving versus position taking. So I've used the word perspective really intentionally instead of position. When people take positions about in the course of a disagreement, they tend to dig in, right? I am set that my child needs OT 3 times a week for 20 minutes in a pull-out session. That's my position, and I'm not moving off of it. And when people kind of find their position and hold to it, it's very difficult to move toward consensus. So we want to don't settle for positions. We want to move past that position and dig a little deeper. Why do you have the position, or why are you taking the position that you are? What are the values or concerns underneath that? What do you really want for your student? Why do you think they need OT 3 times a week for 20 minutes? What is it that's really worrying you? What do you are afraid is going to happen if we don't provide 30 minutes, so 3 times a week for 30 minutes service? Right? Begin to ask some of those more probing questions so we can locate some common ground among team members. Oh, you're really, it seems like you're really concerned about, making friends or the student's ability to organize their day or their life or their stuff, right? Get down to some of that. Often when we dig a little deeper and get beyond position, we're often moving toward being more student-centered and more focused on what the performance issues are. And that's ground where we can problem solve. So, some more thoughts about engaging disagreement. We certainly, on the next slide, want to think about seeking understanding, and that's part of this education process versus merely sitting at the table and pretending like we're listening, right? Understanding is really different than hearing. We just mentioned digging deeper, not accepting these kind of superficial formulations, which positions often are. We want to kind of come at the situation, the disagreement, with a generous interpretation of other people in the situation, which on the flip side of that is avoiding, assigning sinister motives to this. And that's particularly when there's a lot of emotion involved. That's a pretty common place people go, is that this person's just mean-spirited, or they're trying to get back at us for the decisions that didn't go their way last time. Things just kind of get big. So one of the ways to avoid kind of doing that assigning of sinister motives or staying at the superficial level is to really work in the particularity of the present situation, to keep it small and concrete and specific to this IEP that's being developed, to this student, their performance right now, right, in this particular classroom with this particular teacher. That also helps keep us connected to data rather than opinion. Also, when there's disagreement, it is protective for everyone to limit the number of separate or parallel conversations that are going on among stakeholders, and really try to keep the conversation with the whole group, or for there not to be conversation at all. And then moving on to the next slide. So as we're preparing to engage disagreement, not run from it, right, even though that feels uncomfortable, if we're thinking about engaging disagreement, one of the ways we can do that is to think about vision. And so the questions related to vision are: where are we going with the student? How are we going to know when we get there? How long do we think it's going to take? What are our hopes for this student? Possibilities, right? Whose future are we most concerned with? That helps to reorient people, kind of pull them off of their position and get it back on the student. Right, okay, now that we've all answered these things together, are there some commonalities among team members where we can begin to seek consensus? Right, and then once we've identified some of those hoped for outcomes because of the proposed intervention, say, does everybody understand them, share them? Do we have those stated in the IEP, right? Are they, and then we can begin to ask some of our more discipline-specific questions. Is the proposed intervention relevant to and required for occupational performance at school? Is it realistic and measurable? Is it in alignment with the theoretical approaches that the OT is comfortable and competent in working from? Is the proposed intervention in alignment with the task analysis of the proposed or the expected outcome? Right, and is it something that the OT can offer within the standards of practice and their own competence? And really this whole thing is a task analysis of reaching consensus. But it even, like, as I'm saying it, a lot of this just sounds tedious, right? But to engage disagreement and move toward consensus resolution, there are some pretty tedious, like, in the weeds details that we're going to have to consider. And I think this a little bit tedious approaches maybe I'm going to argue a better alternative than to people fighting mad and having to end the meeting, right? So what we're going to do here for the last, as we're closing out, is on your agenda handout, you have 3 different, and those are the last 3 slides of the presentation, Amy, but you've got these 3 different case studies. The first one is about constraint-induced movement therapy. The second one is about sensory rooms. And the third is about exiting service. So what we'd like for you to do is select one of those cases and read it through. Then after you read it, you're going to, there should be some questions to consider. And I think that's the last slide, Aim. Some questions to consider for your case. There it is. Yeah. So we want you to identify the ethical, emotional, and relational dimensions of the situation. Then we want you to, as concisely as you can, in the shortest bullet point that you can, summarize what is the disagreement. Because very often that's a really primary step that an IEP team has not done. They haven't actually articulated what is the nature of disagreement. And so there's the kind of this swirling and swimming around. People aren't really sure what they're even disagreeing about. So it's a really important step to just name exactly and as concisely as possible what is this disagreement. Then we want to, if you can see in your case study, are any of the team members taking a position and what is it? And then what might be some next steps. So it's 3:59. We will check back in with you at 4:09. How about that? I'll give you 10 minutes to read and consider those questions and be ready then to share out some of your answers to these questions. Does that sound good, Aim?
That sounds great, and I just wanted to mention to everyone that if you put it in the questions section, if you don't want to raise your hand or you're unable to, we will still even be able to see this after the session. So we can always, I can always put these
awesome.
comments up later. You know, after the session, I can always send this out if you'd like me to share. So go ahead and put your bullets in that question section, or into the chat if it's easier, whichever's easier, and we'll be able to see everything. I'm going to go ahead and mute myself, and I'm going to try to show all 4 case studies on the screen at once.
Aren't you fancy?
Well, you know, just adjusting the slide show a little bit so that you can see everything. Okay?
Okay. Awesome. And I will mute as well, and we'll come back at 4:09. about 1 more minute to be wrapping up your thoughts on your case. All right, so we'll do the same process as before. You can raise your hand, or you can write a comment into, I guess it's the question area. I don't think I'm calling it the right thing, but I can't see it. So,
My screen, it's called questions, and Sue Poor has put in quite a few questions here. So I don't see any hands raised yet, so I'm going to go ahead and talk about Sue's comments.
Awesome.
She was working with case 3, exit services. She said, A, ethical issues, OT concerns for health and safety, as well as perceived need by staff for coaching. She also says relational issues, dynamics among classroom staff and OT, as well as parent relation with classroom staff, maybe a place for COPM or COSA ahead of time for more client-based information. Also emotional dimensions, perceived pushy dad. How old is this student? 2, anxious OT options for type of service to be considered. Also looking at role of assistants, people versus adaptions in this area as potential option for more mealtime independence.
Great.
Does anybody else have a comment? Go ahead and raise your hand and I can unmute you. Okay. Go ahead, Joy.
I guess my only comment, I guess you can hear me?
Yes.
Yes.
Okay. My only comment about the situation there is I guess I wonder if there are other staff at the school who could maybe take on some role of supervision there, such as the speech pathologist or even school nurse. If the concerns are about safety, perhaps another designee might be willing to take over some of that role. Just my thought about
Right.
that.
Yeah. So what I hear from both comments, we're talking about the case 3 exiting service, right?
Correct. Yes.
If the IEP team's decision is to exit service when the OT really is concerned that the OT services need to continue, some of the problem solving that I hear y'all doing is, all right, decision's been made, I don't agree with it, but can I build capacity with other team members to address some of my safety concerns, some of my concerns about ongoing skill development that the student needs. So yeah, it's not like the best possible outcome, but it's working within the decision that was made. So yes, that is that's sometimes the sort of the problem solving that we have to do is, if not my service, then what are the other resources available to the student to continue to work toward the things that I, as a licensed professional, think are important, like safety and continuing to build skills toward independence. So, excellent. Any comments on one of the other cases?
I'm sorry, I was on mute. I have another comment on case 3 from Ann Lindberg.
Do you see any for case 1 or 2, or can somebody on the line offer a verbal comment on case 1 or 2?
Oh, I have Melanie. Go ahead, Melanie.
Hey, I guess I addressed case number 2 regarding the sensory rooms, and I think reading through this, back to my questions now, that to me the ethical dimension would be that, one, if they're asking for my advice and then something was put in place and then I didn't have any further ability to collect data or supervise, the liability behind that, and also being able to see what is the outcome of that. Just putting something out there in a school and letting it go would not be something I'd be comfortable with.
Right.
The emotional aspect of it would be just, I think, I'm part of a school, I'm part of that team, and I wasn't part of that initially. I think that would be
right.
Yeah,
and now you're coming to me with like the need for some pretty technical assistance.
Yeah, exactly.
Yeah. So let's name that emotion. Wait, what is that emotion that we're feeling here? Let's name it.
A little hurt, on the side.
Hurt, injured, frustrated.
Yeah. And, as far as, I guess, and the sensory room to me is, where does that fall into our curriculum? Has always been, where does that fall in our curriculum? What aspect is that educational? And just going back to that relationship dimension and curriculum versus need, and where my relationship would be as far as addressing goals, the whole sensory room piece, that's where my conflict would be.
Yep. I will just give a little bit of an early marketing plug for we are about to finalize, and at the lead meeting, the leads will have an opportunity to review a final draft of some guidance around the use of sensory rooms in public schools. And I think just hearing some of your comments, we are addressing some of those issues in that guidance.
There are a couple. I'm sorry. There are a couple comments about sensory rooms. Rosemary, she says, most teachers, aides, and administration have no idea what they're doing to the kids' nervous system. Is together with some of these pieces of equipment.
I'm only laughing because I can just hear Rosemary's voice as she typed that comment. Yeah, agreed.
And then also Carrie Barnes, she says, what are the potential ethical dimensions of the situation? Use of the equipment could be harmful to the student if the adults are trained or educated in the effects. I guess that meant are not trained.
Yeah.
What are the potential emotional dimensions of the situation? That the OT is dictating or not supporting the needs at the campus or their students in relation to something that OT could address? And what are the potential relational dimensions of, I'm sorry, I just reread that, disagreement between administration and the OT and classroom staff?
Yeah. So this is one, that's a good point. And Carrie Barnes, another practitioner from Texas. How about it? That hadn't come up before from previous participants, but there are some disagreements that, and this could be one, especially if the school has already established that sensory room, and the principal was like a mover and shaker on it, and or somebody in central office. Like, some of the ethical dimensions become, this person is my boss and I'm disagreeing with them, or they have rank in the organization above me. They may not be who I directly report to, but there may be sort of organizational rank issues that get really messy, right? And I guess that would be some of our relational dimensions, is supervisory structures or chain of command may complicate further some of those relational dimensions when there's disagreement over, in this case, it's the type of intervention, right? So, good point. And if there's one comment written or somebody who's got their hand up about case 1, and then I think we're ready to wrap it up.
Can somebody raise their hand that worked on case 1? Anyone? Looks like everybody was focusing on 2 and 3 in the comment section. So if anybody has worked on case 1, please raise your hand.
And no worries if not. And these cases are there for you. You can take back if you're participating in PLCs or you're doing OT staff meetings. These are, you're welcome to take and use these cases for some of those team meetings. So if we'll just open it up for any random free-for-all questions. They don't have to be related to the cases, anything related to ethics.
Any questions? If you have a question, please raise your hand. Oh, I've got a couple. All right. Go ahead, Christina. Christina, you're on. Barely.
So this is more a question about what we've covered so far, but I have not done this before, and I just got recently engaged, and I'm thinking about it. The reason I haven't answered is because I can't figure out how to do that.
Yeah, so I wasn't able to hear that at all.
Neither was I. Christina, could you type your question in to the question section? Or if you can't, go ahead and email us after the session. I'm going to go ahead and Lori.
Yes, can you hear me?
Yes.
Hello?
Lori, you need to turn off the sound on your computer.
I'm sorry. Can you? I'm next to a coworker. Can you hear me?
Yep. If you could just get away from that computer where the computer audio is being used, it would be a little bit easier to hear.
Okay. Can you hear me now?
Yes, that's better.
Okay. I just wanted some further explanation about the seating arrangements and entry into the room. That was near the bottom of one of the slides.
Yeah.
Seating arrangements and entry into the room.
Let's see. That was on the relational. Where was that? Is it just a consideration about, engaging disagreement? So when we know that we're going to be like processing a disagreement, in this case for our topic today, over the need or type or intensity of OT services, when we know that resolving conflict is on the agenda, it's really important as the team enters the room, like for all the school people to not already be seated in the room and then the parent enters, right? Because we want to make every effort that everybody goes in the room and sits down together, because otherwise the parent's feeling like, gosh, you guys have already been here. You've already figured out exactly what you're going to do with this meeting, right? They feel that's an isolating maneuver by the IEP team to already be in the room and situated. So just builds trust. And then once you do enter the room together, to just really think strategically about who sits where and who's making eye contact with who, putting the meeting facilitator. And I didn't mention, which I have, when we've done this webinar previously, when you know that resolving conflict is on the agenda, which is kind of a weird thing to say, but everybody knows it, so let's just kind of say it that way. It's essential that there is a skilled meeting facilitator, particularly when emotions are high, to be able to honor those emotions but not let them get out of control. You really need a skilled facilitator when you know that conflict is going to be part of the conversation.
Okay.
All right, thank you.
Any other general questions or thoughts about
I have one more from
today's?
Heather.
Okay.
Heather, go ahead. You are unmuted, Heather. Heather Wainwright. Oh, she wrote it in. Hold on. Apparently she's having trouble with her sound. Oh, she had something with question 1, or she said no question. Okay. So that was. I think that's it. I have. They're all comments from the same people. So.
Okay. Amy, can you walk us through next steps in terms of the post-test, the course evaluation, and getting a CE certificate?
Sure. So after we are finished here, everyone should have been logged into this session. So I will see that you're logged in and go ahead and email you the post-test. If you receive a score of 7 out of 8 or 8 out of 8 on the post-test, then I'll send you your course evaluation and CE certificate. Those of you that are in Texas, if you could just let me know who you are, because I can't send you a or just don't take the post-test. That might be better. And that's it. Or actually, those of you in Texas, if you can just comment, I'm in Texas on here, then I'll be able to see that as well. Okay, anything else from you, Lauren?
Nope. I appreciate the participation today, and I'm sorry again about the complications at the beginning, but thank you for your patience, and I hope this was worthwhile hour. And thanks always to Amy McLemore, who got us through this call and handled all of our technical issues. Thank you, Amy.
Oh, yes, and no problem. And also, this session was recorded, so you will be able to actually watch it again if you choose to.
And will this be the one that's posted on the website for future folks who didn't participate in the live session?
Yes, this will.
Okay.
Yes.
Very good. All right. Well, then happy license renewal to all the North Carolina folks. I hope this was something more than checking off the list to get your license renewed. That it was actually worthwhile. All right. Thank you all.
All right. Thank you very much.